CNA Family Guilt Empathy Response. Welcome to the quiz. Question 1. A 55-year-old female resident with multiple sclerosis is experiencing a flare-up, leaving her with significant weakness and spasticity. You are assisting her with a transfer from wheelchair to bed using a gait belt. She tells you, "I'm just so tired today. I don't think I can do this. Let's just forget it." What is the best way to proceed? Option A. Offer to put her to bed in 1 hour, hoping she will have more energy. In the meantime, reposition her in her wheelchair and leave her in the common area to watch television. Option B. Gently encourage her, saying, "I know you're tired, but you'll be so much more comfortable in bed, and it's important for your skin to have a change of position. I'm here to help you, and we can do this very slowly together. Let's just try to stand for a moment and see how you feel. If it's too much, we can stop." Option C. Respect her wishes completely. She has the right to refuse care. Document her refusal to transfer and make a note that she remained in her wheelchair. Option D. Tell her that it's not safe for her to stay in the wheelchair all day and that she has to get into bed. You will need to be firm and use a 2-person transfer with a mechanical lift if necessary for her own good. The answer is B. Balancing encouragement with respect for autonomy is key. Option A is incorrect because delaying may not resolve her fatigue, and she might remain in the chair longer than safe. Option B is correct because it respects the resident's autonomy while gently encouraging necessary care. Option C is incorrect because simply accepting refusal may miss an opportunity to provide care that benefits her skin and comfort. Option D is incorrect because forcing care disregards her autonomy and can cause distress. Question 2. You are assigned to provide a bed bath for an 80-year-old male resident who is Jewish and adheres to Orthodox traditions. He is alert and oriented. A male CNA colleague is available on the unit. What is the most culturally sensitive approach? Option A. Proceed with the bath, but ask a family member to be present in the room to ensure the resident feels more comfortable, allowing you to complete your assignment. Option B. Since you are already assigned, proceed with the bath. Maintain his modesty by keeping him covered with a bath blanket and only exposing the area you are washing, as this is the standard of care for all residents. Option C. Before you begin, knock on his door and explain that you are there to assist with his bath. Ask him, "Would you prefer that I assist you with your bath this morning, or would you be more comfortable if I asked my male colleague to assist you instead?" This offers him a choice and respects potential religious preferences. Option D. Immediately go and ask the male CNA to swap assignments with you without consulting the resident, assuming he would prefer a male caregiver based on his religion. Then inform the resident of the change. The answer is C. Asking about preference respects the resident's autonomy and cultural needs. Option A is incorrect because involving a family member without his consent may violate his privacy and does not address his preference directly. Option B is incorrect because it assumes standard care is sufficient, but some Orthodox Jewish men may prefer not to be touched by a woman. Option C is correct because it directly asks the resident about his preference, respecting his autonomy and potential religious or cultural needs regarding modesty. Option D is incorrect because assuming his preference without asking is presumptuous and disrespects his right to choose. Question 3. A 70-year-old female resident with type 2 diabetes and peripheral neuropathy was found on the floor beside her bed at 2 a.m. She is alert and states she fell trying to go to the bathroom. She denies hitting her head but reports sharp pain in her left hip when she tries to move her leg. What is the correct sequence of actions? Option A. Do not attempt to move her. Keep her calm and comfortable by covering her with a blanket to prevent shock. Immediately activate the emergency call system to get the nurse to the room stat. Stay with her, reassuring her, and report exactly what she told you and what you observed to the nurse upon arrival. Option B. Try to determine the extent of the injury by gently asking her to lift her left leg. If she can do it with some pain, the injury is probably minor. If she cannot lift it, then go get the nurse. Option C. Go and get a second person so you can perform a 2-person lift to carefully move her back to bed, then report the fall and her complaint of pain to the nurse after she is safely in bed. Option D. Since she is alert and moving her extremities, she is likely okay. Carefully help her stand up and walk back to bed. Then put the bed alarm on and document that she was found on the floor and returned to bed without injury. The answer is A. Immobilizing a resident with a possible fracture prevents further injury. Option A is correct because moving a resident with a possible hip fracture can cause further injury. Option B is incorrect because asking her to lift her leg could cause pain and is not an appropriate assessment. The nurse should evaluate. Option C is incorrect because moving her without assessment risks injury. Option D is incorrect because helping her stand could worsen a fracture. Remember, we can take your CNA exam for you, remotely and undetected, and with 85% score guaranteed. No fails, no upfront fees, no deposit, pay only after results. Message us via number in bio to schedule your session. Question 4. You are feeding a 90-year-old resident with dysphagia who is on a nectar-thick liquid and minced meat diet. She suddenly begins to cough forcefully, her face turns red, and she has wet-sounding respirations. What is your immediate action? Option A. Encourage her to take a sip of water to help wash down the food that is causing her to cough. Option B. Stop feeding immediately, instruct her to lean forward slightly, and encourage her to keep coughing to try to clear her airway. Stay with her and observe closely. If the coughing does not resolve the episode or she becomes unable to cough or breathe, activate the emergency response. Option C. Slap her firmly on the back several times to dislodge the potential obstruction, as this is the first step in managing a choking episode. Option D. Leave her to go get the suction machine set up at the bedside so you can suction her airway if needed. The answer is B. Encouraging natural clearing of the airway is the first step for a conscious, coughing resident. Option A is incorrect because giving water could cause aspiration. Option B is correct because the resident is coughing and has wet sounds, indicating she is trying to clear her airway. Option C is incorrect because back slaps are for complete obstruction, inability to cough or speak, not for a coughing episode. Option D is incorrect because leaving her alone is unsafe. You must stay and monitor. Question 5. A resident with an indwelling urinary catheter has a drainage bag that is full. You need to empty it. Which of the following steps is essential for preventing infection and ensuring proper procedure? Option A. Empty the bag into the toilet. Estimate the amount based on how full the bag looks and record the estimated amount on the INO sheet. Option B. Hold the drainage bag above the level of the bladder while emptying it to prevent backflow of urine into the bladder. Option C. Obtain a clean measuring container, put on clean gloves, place a barrier under the drainage bag spout, open the spout, and allow the urine to flow into the container without letting the spout touch the container. Close the spout, measure the urine, record the output, and dispose of the urine according to facility policy. Option D. Disconnect the catheter from the drainage bag to empty the bag more thoroughly, then wipe the ends with alcohol before reconnecting. The answer is C. Aseptic technique during catheter care prevents introducing bacteria. Option A is incorrect because estimating is inaccurate and emptying into the toilet without measuring misses the opportunity for accurate INO. Option B is incorrect because holding the bag above the bladder causes backflow, which can lead to urinary tract infection. Option C is correct because it follows a septic technique, using a clean container, avoiding contact, and measuring accurately. Option D is incorrect because disconnecting the catheter breaks the closed system and increases infection risk. Question 6. A resident with moderate-stage Alzheimer's disease becomes very agitated during lunch, pushing her tray away and yelling that the food is poisoned. What is the most therapeutic response? Option A. Remove the tray to reduce stimulation and validate her feelings by saying, "You seem very upset about your food. It must be worrying you. Let's take a break from lunch for a few minutes. Would you like to walk with me down the hall and look at the pictures?" Option B. Call the nurse to request an anti-anxiety medication so she can calm down and eat her lunch. Option C. Try to convince her by taking a bite of the food yourself to show her it's safe, then encourage her to eat. Option D. Firmly tell her that the food is not poisoned and she needs to eat to maintain her strength. Leave the tray in front of her and tell her you'll be back in 10 minutes to check on her. The answer is A. Validating feelings and redirecting is more effective than arguing with someone who has dementia. Option A is correct because it removes the source of agitation, validates her feelings without arguing about reality, and redirects to a calming activity. Option B is incorrect because medicating for situational agitation is not the first step. Behavioral interventions should be tried first. Option C is incorrect because taking a bite may not be safe, infection control, and could reinforce her delusion if she thinks you are also being poisoned. Option D is incorrect because arguing about the poison may escalate the situation. Great job! Don't forget to subscribe. Bye!